Gentlemen, I'm Dr. Natalie Teo, and in my over 30 years as a urologist here in Singapore, I've seen countless men struggling with something they don't want to talk about. But today, I'm going to share with you a simple 3-minute daily exercise that can genuinely help you reclaim your confidence and vigor. No pills, no expensive treatments, just 3 minutes of your time. So don't click away just yet, because what I'm about to show you can change everything. Look, I understand as we age, especially after 60, many of you notice changes in your erectile function. It's completely normal, but I know it can be frustrating, even embarrassing. Some of my patients come in feeling very stressed about this, worried about their relationship with their wife. But let me tell you something, you're definitely not alone, and there are concrete steps you can take starting today itself. Now, I want to introduce you to something very important but often overlooked, your pelvic floor muscles. Think of them as the unsung heroes supporting your bladder, bowel, and yes, your erectile function too. Strengthening these muscles through targeted exercises can lead to remarkable improvements in blood flow and overall erectile quality. And before you ask, no lah, this won't increase your anatomical size. That's not possible through exercise. But what it will do is maximize the health and performance you already have, ensuring everything works at its absolute best. The exercise I'm talking about is the Kegel exercise. I know for years people thought this one is only for women after childbirth. But gentlemen, I cannot stress enough how vital this is for your health too. In my clinic at Mount Elizabeth, I've seen men in their 60s and 70s who did this consistently for just 6 to 8 weeks, and they came back telling me that erectile firmness improved significantly. One of my patients, Uncle Tan, 67 years old, he told me after 3 weeks, he already noticed better control when going to toilet. After 2 months, he said his wife also noticed the difference, if you know what I mean. So how to do it correctly? First, you need to identify the right muscles. It's simpler than you think. Imagine you're trying to stop your urine midstream, or you're trying to prevent passing wind at the hawker center. The muscles you clench and lift, those are your pelvic floor muscles. They run from your pubic bone to your tailbone. Very important whore, don't tense your stomach, thigh, or backside muscles. It's a subtle internal squeeze, an upward lifting sensation. You can try this while sitting, lying down, or even standing. Once you've found them and you're confident you're isolating them correctly, you're ready to start. Here's your 3-minute daily routine. Consistency is key. Just like how we Singaporeans queue for good food, you must commit to this every single day. You can do it anywhere, at your desk, in the office, in the MRT, while watching Channel 8 drama at night. Step 1, the slow hold, 1 minute. Gently contract your pelvic floor muscles, lifting them upwards. Hold for 3 to 5 seconds. Really feel that squeeze. Then, and this is critical, relax completely for the same amount of time. Don't rush the relaxation. That full release is just as important for proper blood flow. Repeat this 10 to 12 times. This builds endurance and control. Step 2, the quick flick, 1 minute. Now we focus on speed and responsiveness. Rapidly contract and relax your pelvic floor muscles. Think of it like a quick flutter, almost like switching the light on and off quickly. Do this for about 1 minute. This helps with the quick reflexes needed for firm erections. Step 3, the endurance hold, 1 minute. This one builds stamina. Contract your pelvic floor muscles and hold for as long as you comfortably can without holding your breath. Aim for 10 to 15 seconds initially, then gradually increase as you get stronger. Then fully relax. Repeat 3 to 4 times. That's it. 3 minutes every day. Simple, right? But its power lies in consistency and correct execution. So why does this work? It's all about optimizing blood flow and what we call venous occlusion. When your pelvic floor muscles are strong and well-toned, they act like a powerful pump. During an erection, blood rushes into the spongy tissues of the penis. For a truly firm erection, this blood needs to be trapped there. Your pelvic floor muscles play a critical role in compressing the veins that allow blood to leave. Stronger pelvic floor means a more effective blood trap, leading to significantly improved firmness and ability to sustain an erection. Now, many of you are wondering how long before I see results. Based on my 30 years of practice and patient feedback, most men notice initial improvements in 2 to 4 weeks. Better urinary control usually comes first within the first 2 weeks. Noticeable erectile improvements typically appear around week 4 to 6. By week 8 and beyond, if you've been consistent, you should see significant enhancement. But remember, everyone's body is different, so your timeline may vary slightly. Let me address some common mistakes. 1, don't bear down. You're trying to lift and squeeze upwards, not push downwards. 2, breathe normally throughout. Don't hold your breath. 3, focus only on your pelvic floor. avoid tensing your stomach, buttocks, or thighs. And 4, don't overdo it. More is not always better, especially when starting. Stick to the 3-minute routine daily. One more thing some of you asked me about, masturbation. Let me be very clear, masturbation in moderation is perfectly normal and won't negatively affect your results. In fact, some studies suggest it can help maintain healthy sexual function, just don't overdo it lah. Now, while these exercises are incredibly beneficial, they're not a magic bullet for every issue. If you're experiencing persistent erectile difficulties, severe urinary problems or pain, please come see a doctor immediately. There could be underlying conditions like heart disease, diabetes or prostate issues that need professional attention. Early diagnosis is always your best course of action. Gentlemen, taking control of your health is a true sign of strength. This 3-minute daily routine is a simple yet powerful way to invest in your long-term vitality and well-being. Combine this with a balanced diet, regular exercise like walking around East Coast Park, good sleep and stress management, and you'll be amazed at the results. If this has been helpful for you, hit that like button right now, subscribe to my channel and turn on notifications so you don't miss my next video where I'll be discussing prostate health and when you should get screened. Drop your questions below. I read every single comment. What other men's health topics would you like me to cover? Thank you for watching and I look forward to seeing you in the next one.